Hi, this is Chuck Gallagher. My guest is Valda Ford. We've been talking about prostate health, men's health, and all kinds of issues, going down lots of rabbit holes. One of the things, Valda, that you pointed out in one of our earlier segments was once guys determine we are going to live,
Yes.
then the two big issues, incontinence and sexual function, and of those probably 75% of that is sexual function because as men, that is just part of the nature of who we are.
Yes, absolutely.
So let's assume for a moment, in my case is the example that we're using, we have successfully navigated the waters of removal of the prostate, successful surgery. It takes some time to regain sexual function. And you had mentioned it would be 2 months to 2 years.
Yes.
On a very personal level, and I've been pretty personal here, I will tell you at about 11 months, I was very frustrated because nothing was consistent. I knew that possibility existed for an erection, but nothing was consistent.
Right.
And I'll never forget, my wife said to me, she said, you got to get your mind right. And I was
Well,
like,
we know sex starts in the mind.
well, it does. And it occurred to me, if you think of the law of attraction, what you focus on is what you attract to you.
Yes.
And I'm focusing on a
I
lack
can't
of an
do it.
erection.
I can't do it. I can't do it.
Exactly.
Yeah.
So it was like, well, apparently that is what I'm focusing on and that's what I'm getting. So she suggested, well, I think you should talk to a hypnotherapist. Now, some people who are watching this are going to think, wow, that's just woo-woo.
Woo.
But, you know, listen, I try anything.
Yeah.
And I will never forget the experience was very pleasant. It was not unpleasant at all. There was nothing physical taking place. It was just simply going through a reformation in my mind of instead of focusing on what wasn't working, it was focusing on how well my body is healing.
Right.
And how it is healing as it should, and how all functions of my body work in perfect order. And in all honesty, I know some people are going to think, okay, woo-woo, this is stupid, but 2 weeks later, it was like, wow, erectile function is returned. And fairly consistently at that point. Now, admittedly, with the help of aids, Viagra and Cialis,
Sure.
but at least consistently, so that I was like, okay, well, everything is as it should be.
Well, what we know now about the brain, the mind, about neuroplasticity, about the whole thing of if you don't use it, you'll lose it.
Right.
And so if you're constantly telling your body, I'm not going to work, I'm not going to work, I'm not going to work, it says, oh, Chuck is telling me not to work. Instead, it's not getting that other part that I'm thinking this because I'm worried about it and I don't want it to happen. So we know that if you say to yourself, this is going to happen, if you visualize it. And what the hypnotherapist did, and I respect hypnotherapy, I respect all forms of therapy, they help you get clear that your body is great, your body is healed. All you have to do is relax and allow it to happen. I talk about this as an example for people who have trouble with fertility, about getting pregnant. They do all sorts of things, they pay money, they do fertility treatments, they have a baby, and what happens? Another baby comes along naturally because they've stopped worrying about it. So the most important thing is you got good help there.
Now, Valda, in the short period of time we have left, let's talk about something that most men will not talk about at all. But the truth is, once erections return and you're in the moment sexually and you have an orgasm, after surgery, generally that's presumed to be dry. There is no ejaculate.
That's right, because the semen comes through the prostate and then is changed and comes out as that liquid stuff that lets you know that all things have happened. So you have it in your mind that your orgasm is the liquid release.
Right. So that's not true.
Yeah,
and in fact, just as a side note, you can have an orgasm without having an erection.
Exactly.
I know some people will say, what? That's not possible. Yeah, it is.
Yes,
Trust me, it is. But the one thing that was true for me, which freaked me out initially, was that at orgasm there would be a release of fluid, but in my case it was a release of urine.
It could be. That's called climacturia, like CLIMACTURA.
Okay.
So that just means that during climax you might release some urine. Now that's because you're still getting to the point of being able to control what's happening, and in most cases when you have the prostate removed, they're also removing that little valve that is protecting the bladder from dropping urine down into the penis. And it's usually not a lot and it's not a big deal, and over time most men find that that changes and goes away.
So the thing that I think is important in this video is to recognize that it can happen. Now it's the minority of men, 40%-ish or so, but it can happen, and the most important thing is to recognize if it happens, it's normal, and secondarily, talk with your partner so that they're aware of what takes place. So it becomes just a natural part of, well, here's what's happening. For guys, we've typically been accustomed to having ejaculate, so therefore there's, for some people, a little bit of mess left behind. Well, there's still a little bit of mess left behind. It's just in a different form, and it's not going to get you pregnant.
The most important thing is the communication. The partner should be involved from the beginning to know everything about the procedure and everything about what's coming later. Because when you communicate, it's great that your partner is going to know. Sometimes it's not going to happen at all. Sometimes it's not going to happen when you want to. You can get started and the erection goes away. Or, oh my goodness, there's no ejaculate, so where you were expecting that, you're not going to feel that. And occasionally there might be urine, so big whoop. You put a towel underneath and you keep on going.
Right. Well, you know, Valda, the thing is, rarely do you find the level of discussion and the candor of discussion that we're having here, and I think that's one of the most important things about this segment on men's health and prostate health, is to know what to expect so that the unexpected doesn't cause a problem for you, your partner, or continued life.
Right. You're going to have a great life after prostate surgery as long as you have some good information, good communication.
Absolutely. My guest is Valda Ford. I am Chuck Gallagher. We're going to continue talking about men's health and prostate health. There are plenty more questions coming up, so stay tuned.